Corey. Guess we're recording now. It's good to have that reminder, even though it's always a little surprising. But good morning, everybody. It looks like we've got about 50 folks who are dialed in, and so I hope that this turns out to be a useful presentation this morning for you all. A little bit of background. I'll just quickly introduce myself. Dan Hindershot, Environmental Health Manager with Summit County Public Health Department. I think I know probably most of you, even though I can't see you at this point. Hope you're all doing well. So, of course, we're rounding the bend on the COVID pandemic. We hope things will continually, de-escalate a little bit as we see more waves coming in the future. Certainly, we hope that they're less dramatic and stressful on all of our day-to-day lives. We reached out, public health reached out to the Colorado Department of Labor and Employment maybe a couple of months ago, I believe. And Heidi, one of our contact tracer leads, and I met with Eric, and he gave us this presentation 4, 5, 6 weeks ago. And the reason that we reached out to him was as we were doing our contact tracing with folks who were COVID positive or needing to quarantine, we are learning that a lot of supervisors were not aware of some of the current laws, Colorado laws and regulations that govern employee sick leave. And some of those rules have changed recently. And we had no idea of what some of the rules were, and we're very informed as we met with Eric. And so we are hoping that this would be beneficial to our business community as we try to continually, avoid illness from COVID and just other illnesses that we deal with every day and continuity of operations. So again, a big thanks to Eric. Is it Yohi? Is that, I should have asked you beforehand. Is that how you pronounce it?
You're close, Dan. It's Yo-E. You just kind of forget the H is there.
Okay. Well, thank you very much, Eric, for presenting today. Feel free to put any questions in the chat as we're going along, and we'll try to address those at the end of the presentation or as we're going along as appropriate. So with that, thank you, Eric.
Thank you, Dan. Welcome, everybody. Good morning. My name is Eric Yohe with the Division of Labor Standards and Statistics, which is part of the Colorado Department of Labor and Employment. Before I get going, I want to make sure that my presentation is being seen by everybody. Okay, perfect. As I said, I'm the outreach manager for the Colorado Division of Labor Standards and Statistics. And we're going to talk today solely about what's called the Healthy Families and Workplaces Act. That's the long title of the law that requires 2 different types of sick leave be paid by employers to employees in Colorado. I'm not going to walk through the entire agenda here because you're going to get it when we see it. I'm going to talk about the 2 types. I'm going to talk about the basics. Pay rate for the paid sick leave, how many hours are involved, when can employees use paid sick leave and for what reasons. We'll talk about some documentation, record keeping and notification requirements, and I'll make sure to have time for a Q&A here at the end. And I'll also have a slide, and you will all have access to these slides after the presentation. I'll have a slide for resources that you can reach out to, both specific resources and website resources after the presentation. I quickly want to talk about what we do and who we are. Like I said, I'm the Division of Labor in the Division of Labor Standards and Statistics. That's a small division within CDLE, the Department of Labor and Employment. I'm not going to walk through all these divisions here. Some of these you probably deal with on, very often, including most likely the Division of Unemployment Insurance and maybe the Division of Employment and Training or Workers' Compensation as well. We are just one of the many divisions. I will state that having the Division of Oil and Public Safety on this slide is not a mistake. I can't tell you exactly why they're part of labor and employment, but they've been a part of us for several decades. But I'm going to concentrate on our division, and I'm going to concentrate on the labor standards piece of the Labor Standards and Statistics Division. In Colorado, if there's something you think of as a wage and hour law or a leave law or just in general labor law that's not related to employment discrimination, our division is likely the division that enforces that law and can provide information about that law. We spend a lot of time lately educating folks on the Healthy Families and Workplaces Act. That's what we're going to talk about today. But our two all the time most important laws and regulations that we end up getting questions about and investigate complaints on are the Colorado Wage Act and what's called the COMPS order. It's the Colorado Overtime and Minimum Pay Standards order. So our typical bread and butter is answering questions about and investigating complaints on unpaid wages, impermissible deductions, time worked, overtime, minimum wage violations. That's typically what we do, and that's still about 90% of the complaints that we receive and we adjudicate. We also have some other laws related to the employer and worker relationship. You may be aware of the Chance to Compete Act that's been around for a couple of years now, also known as Ban the Box, that has some limitations on asking about criminal history in an initial application. There's the equal pay transparency requirements that are part of the Equal Pay for Equal Work Act. By the way, that is a whole nother presentation I can do if folks have questions about that law. It's a completely different type of law that we're now enforcing, different from anything we've done before, and a little piece called the Colorado Warning Rules that generally we don't see come up. The warning rules are related to retaliation in employment, Colorado employment law, which I actually, thankfully, don't see a lot of from Colorado employers. So I won't be spending a ton of time on that. The other piece of our division is statistics, and that's labor market information. All I'll note here, and you'll have access to this link here. Our labor market information group creates a great deal of labor-related and employment-related statistics. Anytime you see anything related to Colorado unemployment rates or anything similar to that, it comes from that group. But there's a lot more information that they can provide. They have information based on industry in terms of normal wage rates for specific occupations, and it goes from there. It's a really great resource, and I encourage you to take a look at it. But let's spend most of our time on the Colorado Healthy Families and Workplaces Act. Forgive me, I don't like using jargon during presentations, but I'm not going to repeat myself saying the Colorado Healthy Families and Workplaces Act 35, 40 times. So in-house, we call it HIFWA, and I will be referring it to HIFWA as we go through. Like I said, I apologize ahead of time for using that jargon, but trust me, it's much better if I do it that way. Okay. So the Colorado Families and Workplaces Act. A lot of you know it as Senate Bill 2205. It's actually been in effect since July 15th of 2020. At that time, there were some different requirements related to making sure that employers were compliant.
Los empleadores cumplían con las familias, la ley de respuesta COVID para las familias. Eso fue en 2020. Otros requisitos que.
This law applies to all employers and employees in Colorado as defined in the Colorado Wage Act. But there's a wrinkle. All employees of state and local government agencies are also covered by this paid sick leave law. That's not normal with regard to wage and hour law. There are very few laws that we have enforcement ability over state and local government agencies. But when this bill was passed, the sponsors made clear that it wasn't enough just to provide these protections to private sector employees, but to provide them to public sector employees as well. Okay, there's two types of paid leave we're going to talk about today. The first one you're just going to hear me refer to as accrued leave. If I slip, I might call it Section 403 leave because that's the section of the law that requires this accrued leave. And then there's public health emergency leave, which I'll likely just call PHE leave as we go through. That's found in Section 405 in the law if you're interested. Okay, before we get going too far, I want to make clear that unpaid paid sick leave in Colorado is considered wages under Colorado law. That's an important distinction. In general, going back decades, unpaid paid sick leave, if an employer offered paid sick leave and didn't provide it and didn't pay it, there were really no repercussions under Colorado wage law for not paying it as I stated they would, or in accordance with any sort of agreement. Paid sick leave under this act, under HIFWA, is wages. That does not mean it has to be paid out at separation, but what it does mean is if an employee is denied paid sick leave, they have the right to file a complaint with our office or to file suit under the Colorado Wage Act in the appropriate court, whether it be small claims, county court, or district court. I don't want to be heavy-handed on this, but this is kind of a big deal in terms of kind of a sea change in terms of how any sort of paid sick leave is treated. And just know that the paid sick leave that is required under this law is something that my division has authority over. Okay, so accrued paid sick leave. I'm going to apologize for the really dense slide here. I'm just going to summarize. When it comes to accrued paid sick leave, the minimum accrual requirements are easy. It's 1 hour of paid sick leave for 30 hours of work, and an employer does not have to provide more than 48 hours of paid sick leave. It's paid at the same hourly rate or salary and with the same benefits. All that really means is if someone has to take leave under the act, they can't, while they're taking that leave, they still continue to accrue any sort of benefits that are part of their employment. They still must be covered by any health insurance they have, anything like that. As of January 1st of this year, this accrued leave applies to all Colorado employers regardless of size. Smaller employers, that means employers with 15 or fewer employees, had a 1-year reprieve from complying with this law. But now, as of January 1st, 2022, it applies to all Colorado employers and their employees. Starts on the first day of an employee's employment. Accruals based on time worked, which that is actually a legal definition in the Colorado Overtime and Minimum Pay Standards Order, but it's typically what you consider time worked, what you pay the employees their hourly rate for. It's the same amount. I may mention this on another slide, but I did get this question. The amount that must be paid for tipped employees where an employer is taking a tip credit against the minimum wage, the amount of paid leave must be at least the full minimum wage, which this year is $12.56 per hour, or it must be any applicable local minimum wage, which is currently only Denver, the city and county of Denver, but going forward in the future, it could include other counties or other municipalities as well. Overtime exempt employees. So what you consider overtime exempt employee, they generally work 40 hours or more a week. You don't pay them overtime, and a lot of times you don't necessarily track their hours. In that case, the accrual rate is just based on working 40 hours per week. If a exempt employee ends up working 50 hours 1 week, they don't accrue based on that 50 hours per week. They accrue based on the 40 hours. Employers may choose faster accrual than 1 hour for every 30 hours, and they may provide more generous leave. And the law encourages that. There's no requirement to do that. The last piece on kind of these basics of HIFLA are an employer may use a more general leave plan like PTO to comply with HIFLA, but it must provide at least the same amount or more leave to be able to be taken for all the reasons that HIFLA requires. I cited a rule here, and you'll have a link to this as well. It's the Colorado Wage Protection Rules, and it's specifically 3.5.4. If it is an employer you choose to use your own leave plan to comply with the requirements of HIFLA, there are specific requirements you must meet. And the biggest one we see employers fail to do is notify their employees in writing that they are using their own PTO plan or general leave plan to comply with HIFLA. If you do not do that, then you cannot use your own leave plan to comply with the HIFLA leave requirements. And I'll kind of pause here. And we will have a Q&A session, but if I am able to answer some questions, looks like, Dan, we're good so far.
Yeah, I believe you answered the question that was presented regarding overtime. Then we just got one. Eric, will you please clarify what the difference between paid sick leave and unpaid sick leave is and how it applies here?
Okay, good. Two good questions. I'll follow up real quickly on the overtime piece. So if you have a non-exempt employee, all hours they work, including overtime hours, must be included in the accrual. Now, you don't have to have them accrue at a rate at time and a half, at 1.5 the number of hours worked. It's just for each hour. So if a non-exempt employee works 46 hours in a week, they accrue based on those 46 hours. Yeah, and I will repeat the PTO plan piece. So paid sick leave is paid sick leave. I have a question here that says, what is the difference between paid sick leave and unpaid paid sick leave? What I mean, the distinction there is that if an employer does not pay paid sick leave under the law, that is now wages that an employee can claim. That's the only distinction. We're talking about the same piece. We're talking about paid sick leave that's required under HIFLA. But if it remains unpaid when an employee requests to take it and they're entitled to take it under the law and it remains unpaid, then that becomes wages that an employee can claim through the process through our division or through court. The disclosure requirements, question about disclosure requirements for using your own PTO plan. I'll make sure I have a link to this, but basically the disclosure requirements include essentially restating the rule that's here on the screen, the Wage Protection Rule 3.5.4, and notifying employees that you will be using your general leave plan or PTO plan to comply with the requirements of HIFLA. One thing that rule allows you to do, but you do not have to do, or allows you with regard to your employees, it allows all leave to be used for any reason, as long as it can also be used for HIFLA reasons. And you can state in your notification that if the employee exhausts all their leave for any reason under your PTO plan, then you do not have to provide additional HIFLA leave. The basic example we use is, say someone has been given 40 hours of leave or 80 hours of leave under the PTO plan, and they provide this notice to their employees. And the notice says, if you take this for any reason, including, say, take a vacation, you will exhaust your leave under the law. And then that employee goes and takes 2 weeks of vacation. You have complied with the law, and you do not have to provide any additional paid sick leave if the employee needs to take paid sick leave. That was the intent of the sponsors. They made that very clear. The sponsors of the law, they made that very clear. Just be careful and make sure you go to that rule, take a look at it, and make sure you're complying if you choose to do that. Yeah.
I would suggest that we get back to the
Yeah, we will.
presentation, and then I'll kind of pick us up at this Q&A once we get through. I just want to make sure we get through your presentation.
I get that, and thank you, Dan. This was just a good.
Yeah.
These are the types of questions I get often. I wanted to make sure that we address them now and didn't forget to address them. Okay.
Yeah.
Qualifying reasons actually for accrued leave are fairly simple and they're fairly broad. Anything you could think of in terms of what would typically be used for paid sick leave is a reason an employee can take under this law. A mental or physical illness, injury, or condition that prevents work. A qualifying reason includes obtaining preventative medical care or medical diagnosis. One thing this law adds that is not necessarily typical from other laws across the country, similar laws across the country, is that it adds a qualification if someone has been a victim of domestic abuse or sexual assault and needs to take leave related to that, that is covered under this law and is a reason they can take that leave. This leave can also be taken to care for a family member who needs care for any of the three reasons listed above. Number 5 is also part of accrued leave, not public health emergency leave. I'm not going to talk about this much because it's purely related to a public official closing a place of business or say a school for a child. And so the employee is not able to work because that place has been closed by a public official due to a public health emergency. We don't see that much. We saw that some at the very beginning of the pandemic, but we see very little of that now. So I don't want to confuse you too much about that because it's a different requirement than what's in public health emergency leave, which I'll talk about in a second. So we're now moving from the accrued leave, which is always in effect and will be in effect as long as this law is still a valid law in Colorado. Public health emergency leave is contingent on there being a public health emergency. And in this case, we still have a current COVID-related public health emergency. This leave we're about to talk about is still in effect and will be in effect through at least May 14th of 2022. The way that date is currently calculated is that the current federal public health emergency for COVID declared by the Department of Health and Human Services is in effect until April 16th. And the law allows employees to take public health emergency leave through 4 weeks after the end of a public health emergency. One thing I will note with regard to this, we do have a website dedicated to paid sick leave on our website, but you'll have that link. We do have a web page on our website, that is. We will keep, we have right now, we have in big red bold letters, the public health emergency is still in effect. And at any time we become aware that there will be that there are no longer any qualifying public health emergencies in effect, we will put that note on our website and we will let you know when the end date is of public health emergency leave. Okay. The purpose of public health emergency leave and the requirement is that employers must supplement whatever amount of paid leave the employee has to ensure they can take up to 80 hours of leave for public health emergency related reasons. And they're pretty standard. I'm not going to read the entire list here, but especially early in the pandemic, but still now, it allows for employees to self-isolate if they experience symptoms or are diagnosed with a communicable illness, in this case, COVID, seek or obtain a medical diagnosis, same sort of reasons, or seek preventative care, which includes things like getting a vaccination. Okay. As I already stated, an employee may use public health emergency leave until 4 weeks after the termination of public health emergency. Okay. To provide specific examples that public health emergency leave includes reasons an employee can take leave under this section of the law include getting a COVID-19 test, getting vaccinated, recovering from any vaccination side effects, following a mandatory quarantine, or caring for a family member with any of those needs. Okay. What an employee can take public health emergency leave is pretty straightforward. How much and how does public health emergency supplement interact with the accrued leave that employers are required to provide? That's a little more complicated, and we'll try to get into that here. So for full-time employees who work 40 or more hours in a week, the supplement must be made so that an employee may be able to take up to 80 hours for COVID-related reasons. For example, let's say someone has already earned their 48 hours of accrued leave. That means that the public health emergency supplement to get them to 80 hours for a full-time employee is 32 hours of the public health emergency supplement. If employees are working less than 40 hours in a week, it's basically the amount of the supplement must get you to a number that is equal to what the employee typically works on average in a 14-day period for 2 weeks. That 80 hours, of course, is basically calculated on a 40-hour work week. The intent was to provide up to 2 weeks of leave. So with 40 hours, you get with employees who are working less than 40 hours, you do the same thing. But when the employee goes to take the leave, when they request the leave, what you're going to do is either provide the number of hours that the employee is scheduled for work or paid leave in the upcoming 14-day period, or actually worked on average in the 14-day period prior to leave request. It's whichever is greater. Accrued leave may count towards the public health emergency supplement. So in that example I gave where the employee had already accrued 48 hours of leave, and then they had a 32-hour supplement, let's say that employee was started at 0 and continued to accrue leave. As they earned 1 hour of leave for every 30 hours of leave, for 30 hours of work, basically the amount of accrued leave would go up and the amount of the supplement would go down. So when someone hit 20 hours, there would be of accrued leave, the supplement would be 50. By the time they went to take leave, if it was 40 hours of accrued leave, they could take, the supplement would be 40, and it works up until the point that you get to that cap of 48 hours. This is all of this applies when an employer is not using their own plan to comply with HIPAA. Okay. Accrued leave and PHE leave are paid at the employee's regular rate. That's a pretty common measure. For more information on the regular rate, you can find that in some of the materials I'm going to provide to you on the last slide. It's found in our comps order. It's also found in Rule 3.5.2 of those wage protection rules. But the regular rate is pretty standard. It's usually your agreed upon rate of pay. If you are paying employees by another method, by the piece or the job, typically what you would do is to determine the regular rate is you would determine their gross amount earned over the time period in question and divide it by the number of hours worked. And that's how you would get the regular rate of pay. So if an employer is paying someone by the piece or by the job, something that's not hourly, those employers still must comply with the law. Let's see. Okay. Can employees use paid sick leave? And what we mean in that question is, when is it available? As I said before, accrued leave and public health emergency leave are paid at the employee's regular rate. Tipped employees must be paid at least full minimum wage. And employees may use the accrued paid sick leave as it is earned. Employer may require the use in hourly increments or greater. You know, if an employee wants to take 15 minutes of leave, you don't have to allow that. But if they want to take an hour of leave or 2 hours of leave, that must be allowed. When this first started, we had school districts, and I understand the reason behind the request. School districts asked if they could have some sort of exception for substitute teachers, who they generally schedule on 4-hour shifts, either morning, afternoon, or all day. Unfortunately, the law doesn't allow for that sort of exception. One thing I will note, employers can loan leave, accrued leave, in advance of it being earned. I don't know that we've seen much of that, except for the fact, and I guess this is a loan, many employers have chosen to front load all of their 48 hours of leave on January 1st at the beginning of the year. They've stated, instead of keeping track of the accrual, they've just felt it was easier or a benefit for the employees to go ahead and provide that leave on January 1st at 48 hours. Okay. Unused accrued leave rolls over from year to year, and this is a question I get a lot. An employer never has to provide more than 48 hours of paid sick leave in a year. An employer never has to allow them to have more than 48 hours accrued at any point. If an employee had accrued 48 hours of leave in 2021, and in 2022, they didn't use leave at all in 2021. On January 1, 2022, the employer must carry forward that 48 hours of leave. However, the employer has now met the requirement for 2022. No more leave has to be accrued. An employer can choose to do that, but no more leave is required to be accrued. We get that question a lot, and we actually get it from accountants a lot, because they want to read the law to say that 48 hours, even though the employee can't take it, continues to accrue in the background, and that's not our interpretation at all. Okay. So that is the bulk. Our slides about documentation and record keeping probably won't take too long. So Dan, I think this is a good time to talk about public health emergency leave if we have some questions.
Sure, let me go back up here. I think we stopped at 9:50.
Okay. Okay, well, I'll try to get through most of these. We do have a lot. Okay.
So, the
do we
last
pay?
one I saw was from Hillary. Can you repeat the
Okay.
requirements? So I think we're on the next one here.
Yeah. So we're now on, do we pay paid sick leave? Do we pay sick leave and paid time off?
I believe so, yes.
Okay.
Yep.
So this is from Penny. I'm not sure I understand the question. You can choose to comply with HIFWA separately than your paid time off. You can have the employee accrue up to 48 hours per year. You can also provide them the public health emergency supplement and have your own paid time off plan. And many employers have chosen to do that for, I guess, a variety of reasons. Simplicity seems to be one of them, but I understand it is more costly. But an employer can, as I've talked about, use their paid time off policy to comply with the law. But to do that, they must meet those requirements in that rule 3.5.4. I don't have them listed here because it does take some time to walk through them. But basically, the biggest piece is that you notify employees that you were using your paid time off to comply with the paid sick leave requirements. Do you need to track sick leave for seller employees if you have a flex time policy? I would like, Abigail, I would like to go ahead and wait until we get to the next slide to answer that question. We'll talk about record keeping. Not required to pay HIFA paid sick leave out at termination. That is correct. It's not really an exception, but a kind of a qualification. If an employee comes back, leaves, and then comes back within 6 months, their earned paid sick leave must be reinstated at the amount it was when they left. Okay. Well, I got to thank you. Well, you're welcome. My company is under 50 employees. Do I start HIFA this year? Yes. But understand that public health emergency leave has been in effect for all employers since January 1 of 2021. Okay, it's just the accrued paid sick leave, the Section 403 paid sick leave that starts as of 2021. If so, do the hours for the employees start in 2020? Yes, the accrual starts on January 1st, 2022 for smaller employers. If you provide employees with the notification that PTO will cover the sick leave requirement, do you need to keep providing notification on an annual basis? The law and the rules don't necessarily state that. I would say it would be a good idea to do so. If this were to come up, the burden is on the employer to show that they notified the employees. But no, the law doesn't state that it has to be done on any regular basis. Okay. All right. Okay. I think I missed where I was at. There. Okay. If you provide leave with notification. Okay. Does this cover side effects of after vaccination? Yes, it does. Public health emergency does. It would also fall under the regular accrued leave as well. If you opt to do your own plan, is it up to the employee to specify if they want their sick time paid or not? Okay, so if you're using your own plan to comply, there's no distinction between any of the leave, and you have to make that clear to employees. So for example, the employee knows that they want to use 80 hours in June, they're ill in April for 5 days. Is it their option to decline payment? The law doesn't really address that piece. They're obviously entitled to take that leave. You know, the law doesn't dictate what an employer's PTO policies are as well. So I don't know that I can provide you a very specific answer to that as to whether or not it's an option to decline the payment. Again, if you're using your own policy, as long as the policy complies with the law as I talked about, then you would continue to follow your same policies when it comes to unpaid leave. Okay. Public health emergency leave, does that include caring for a child whose school is closed? So no, but that is covered under accrued leave. It was the 5th reason on that slide for accrued leave. So it is still leave that can be taken. Okay. Okay, we're going to get to what documentation can be required in a little bit. The question I have is what proof is allowed and required from the employee to quantify 405 leave. The law is clear, and I understand the concerns around what the law says. The law is clear. No documentation can be required to take public health emergency leave. And we'll see it on the next slide. Yes, this is, Christina, you explained this better than I did. To clarify, as an employer accrues paid sick leave, their pandemic allocation reduces by that accrued amount. That is absolutely correct. Okay, if it is used, the accrual then does the accrual then reset for the new year? Yes, if someone used accrued leave, they're entitled to up to 48 hours the next year. And if they only carry over a fraction, say 20 hours, then on January 1st, they will begin to accrue again up to 28 hours. Okay. I did get this as this question from Chris. I got this in advance. To CDLE have sample policy or procedures for employers to modify, include in employee handbooks. Unfortunately, the division does not have that authority and does not provide those sort of resources. Unfortunately, we're unable to do so primarily because we're an adjudicating agency. We actually adjudicate the claims, investigate and adjudicate them. And so there's some issues there in terms of if we have provided policies or procedures and they were misunderstood, and then that came up during the adjudication. Can notification of a substitute plan be part of an employee handbook? It may, but note that employers will have to be able to provide proof that the employee was notified in writing. So as long as there's some acknowledgement that they saw that provision, read that provision, then that would be fine. What about when an employee changes status from full-time to regular part-time without a break in employment? Okay, so when it comes to accrued hours, remember that there's no distinction between full-time and part-time employees. They both accrue 1 hour for every 30 hours, up to 48 hours in a year. There is no distinction under accrued leave in terms of how employees accrue. It just so happens that a part-time employee will in actual time accrue a little more slowly than the full-time employee. Okay, so is it correct that the 405 leave, public health emergency leave, is a one-time shot beginning in 2021? So there's some language in the law that can be a little confusing. It is true that the supplement for COVID-related leave is one time for the duration of the public health emergency, but that has been interpreted by some to mean if an employee had to take just 2 days back in January of 2021, that the employer did not have to provide any more public health emergency leave for the duration of the pandemic. That is not true. It's one-time allocation of up to 80 hours that can be used for the duration of the public health emergency. I hope, Laura, that helped. And we're caught up and we actually have a good amount of time here. Documentation and record keeping. First, we're talk about documentation. When it comes to accrued leave, the 403 leave, employers can require reasonable documentation, but only for 4 or more consecutive days of leave. It can be submitted by any reasonable method. It can include an employee's own written statement. Insufficient documentation requires notice to an employee and an opportunity to cure. Not providing that notice, there are some more details with regard to reasonable documentation in Wage Protection Rule 3.5.6. When it comes to 405 leave, the answer to requiring documentation is easy, though not necessarily easy to implement. Employers, and the law is clear, may not require an employee to provide documentation that leave is for a qualifying reason that's related to a public health emergency. So to take 405 leave, an employee cannot be required to provide documentation to take that leave. I understand the complications that come with that, and I understand how there may be employees who do take advantage of that requirement. Okay. Okay. Documentation, record keeping, continued. Record keeping requirements are pretty simple. Employers shall to retain records for a 2-year period documenting hours worked, paid sick leave accrued, paid sick leave used. This is really pretty much duplicative of the requirements that employers already have under the Colorado Wage Act and the comps order, the Colorado Overtime and Minimum Pay Standards order, which require records to support all items that go into a pay statement and to support, any, how much time they worked, how much leave they took, basically support what they've been paid. And those records have to be kept for a 3-year period under the Wage Act. So there shouldn't be a huge difference with regard to keeping records related to the accrual of leave. Okay, if an issue arises as to an employee's right to paid sick leave and they haven't maintained those records, which I'm pretty certain all of you are already, whether you knew it or not, then if there were some sort of claim, there's this rebuttable presumption that the employer violated the law. I know that seems pretty strict. I just will note you're likely already compliant with the record keeping requirement. And the whole point here is so that if an employee were to file a complaint, that the employer knows that they were required to keep records to show they were compliant with HIFLA. So however you maintain it, if you're able to prove that you provided the correct amount of leave as required by the law, then that's all that's required when it comes to record keeping. Okay, and I'll answer some of these questions in a second. The last piece, the administrative area, is there is a paid sick leave poster. It's a paid leave, whistleblowing, and protective equipment poster. Yeah, we kind of all jammed it into one poster. It's available on our website. There's a link on our website to get to the poster. We provide those to not just in English and Spanish, but in, I think, 11 other languages right now. And if you have an employee whose primary language is a language that's not on our website, send us an email, request that we provide that poster, get it translated into that new language. That is a service we provide, and we generally will get that out in about 3 to 4 weeks. Okay. And just really briefly, we don't see this very much. Just note that any sort of adverse action against an employee for asserting their rights under HIFLA, and that HIFLA, when it says this part 4, that means the Healthy Families and Workplaces Act. Any adverse action is retaliation. It is something an employee can file a complaint on. To be honest, we see very few retaliation complaints when it comes to HIFLA. Okay, so I know that was a lot. I appreciate you sticking with me, and I'm gonna go.
I think we're at that question at 10:17 a.m.
Cool. Awesome. All our FTE staff accrue 80 hours of sick time per year. Does this cover the HIPAA and public health emergency requirement? This is a question from Mindy. Mindy, again, the answer is maybe. Just doing this is not enough. You must comply with that rule 3.5.4, which includes the written notice requirement. and the employees must know that they can exhaust their paid sick leave entitlement without ever taking paid sick leave, if that's your intent. So it's not just providing, and also understand accruing may not be compliant unless you make sure that you provide public health emergency leave as required by the law before the staff actually accrue their 80 hours. Generally, when we see employers correctly comply with HIFWA using their own policy, their PTO is provided up front and not accrued. I'm not saying you can't have an accrual method based on hours worked or just time periods worked, but just be careful and make sure that you're not violating the public health emergency leave requirements by requiring them to accrue this leave over time. Okay. Laura, I'm not sure what I need by what you mean by the question may be.
I believe the context there was staff may take advantage of the inability to prove documentation.
Okay.
I think that's about when she posted that.
That makes sense. Oh, if you pay out all paid time off when an employee switches from full-time to part-time, and then as a part-time employee starts accruing from scratch. Okay, does this meet the requirement of HIFWA? On its face, that does not appear to meet the requirement of HIFWA. Employees must be able to take that leave for paid sick leave reasons. And even if you pay it up front, they haven't had the ability to take that leave. So on its face, but again, I don't have all the facts here, it does not appear to be compliant. Would it be appropriate to keep 48 hours of the PTO to switch to their, that sounds like, again, you know, I can't provide specific legal advice, but would it be okay to keep the 48 hours of PTO to switch to their paid sick leave, sick pay balance? Yeah, that likely would make the employer compliant. Okay. For 405 leave, if an employee tells you they tested positive, are you saying we cannot ask to see that? I'm not saying that. The law is saying that, unfortunately. The law says no documentation can be required to take Section 403 leave, 405 leave, excuse me, public health emergency leave. Okay. Currently, the end date, I have this on a previous slide for the public health emergency leave, is May 14th. And that's based on the current Federal Health and Human Services Department declaration. Okay. When the public health emergency goes away, possibly in May, does this all go away? No. The public health emergency leave requirements, the Section 405 leave requirements go away. The accrued leave, Section 403 leave requirements are in effect as long as the law continues to be in effect. Okay, these are some fantastic questions. I really appreciate you taking the time to write these. I think we have about 3 minutes and I want to be cognizant of your time. Dan, do we have time to take a few more questions?
Yeah, there's one more here. Let's kind of end it with that and then we can do a wrap up.
Okay. So forgive my ignorance. So the question is, circling back on salary employees, do you need to track sick time use if we have a flex time policy? I'm not sure I understand the distinction. I know what flex time policies are, but if the implication here is an employer can require an employee just to change their schedule to avoid leave, that would likely be not compliant with the law. So I would be careful about that. You know, certainly there are times when an employee will be able to you know, go get a test or a vaccination outside of working hours, but if they're scheduled for that time and they need to take that leave, they're entitled to that leave. I probably didn't answer your flex time policy question like you wanted me to or fully. You may want to just reach out to me directly, and once I send out the slides for this presentation, you'll have that contact information. Might be better if you reach out directly to me to give me some more details. I understand you cannot ask for proof to use public health emergency leave, but can we ask if they were absent for work for 3 or more days or so we know when they are good to come back to work? The law does not prohibit an employer from requiring documentation of a negative test to return. It only requires it only prohibits documentation to take the leave. You can't deny someone or not pay them the leave because they didn't require you to provide documentation to you. But if you choose to ask for an employee to provide proof of a negative test, then you may do that. There's nothing in the law that prohibits that. Okay, I have a question for preventative care for a part-time worker, how to handle leave requests. I'm not quite sure I understand. Employees are still required to take leave for preventative care. And if they have to take that leave during a time that they're scheduled to work, an employer must provide that leave. Again, it's difficult to get into very specific situations. And I do get that sometimes the law looks like a blunt instrument here, but I can't necessarily provide much guidance on that piece. Okay. I think, Hillary, I did answer that question. Yes, you can reach out to me directly. Feel free to do that with regard to your business operations. Okay, we don't track time off for salary employees, and this will be the last one because we're a little bit over. If there's a way for us to capture those last 4 chat questions and get them to me, that would be great. But this last one I'm going to do is, we don't track time off for salary employees. So do we need to track time? Well, the law requires that you keep records of paid sick leave, accrued and used, and hours worked. But note that, as I mentioned earlier, the only remedy is that there's this rebuttable presumption that the employer didn't comply with the law. If the employer can then, in terms of paying paid sick leave, if the employer can prove that they paid sick leave to the employee as required, then the fact that they didn't necessarily keep those records is immaterial. But note, if you're keeping just some sort of minimal tracking that, you know, they're going to be accruing at 40 hours per, you know, 1 hour for every 30 hours worked based on a 40-hour work week, and they were able to take leave as required, then that should be fine. Okay. Thank you all for your time, and Hillary, thank you for your thank you. I understand it's a difficult law, and I wish we had more time, but I do want to be cognizant of everyone's time. So I'll give this back to Dan.
Well, thank you very much, Eric. And again, I appreciate your willingness to have an open door policy there and welcome questions. We'll follow up with an email out to everyone with the slide deck again and with a recording of this webinar as well. And I just want to give our partners over at the Chamber an opportunity. Blair got pulled out in 5 different directions, I'm afraid, before the meeting got started, and so was a little late in joining us. So want to acknowledge Blair and Corey for their partnership on getting this message out. Blair, did you want to say any final wrap up?
Yeah, thanks to Dan and Eric for your time, and Dan getting this set up. We're thrilled to partner with the county on this, and just lots of questions, and we anticipate those questions to continue. So reach out to me, reach out to Dan, reach out to Corey. We're here and we're available and here to help. If you have a question, most likely others do too. So let us know. We know that these are still a lot of changes taking place right now, and so if there's a topic that you really would like to see attention focused on, reach out and let us know, and we'll try to get something set up. But again, thank you to you all for your time and your very great questions, and thanks again to Eric and Dan for getting this going.
Sure.
Great. Well, I hope everybody has a good rest of their Tuesday, and we'll see you around town. Thank you.